Taking care can be so easy. It's as easy as 1, 2, 3. Whether you're family, friend, or neighbor, come on, take a stand. A hug, a smile, a patience, or sometimes just to hold our hand.
A message from the Caribbean Child Support Initiative, a program of CARICAD with support from the Bernard Van Leer Foundation.
Take good care of the children.
A picture is worth 1,000 words. Got it? Taking care of us can be so easy.
Take good care of the children.
Welcome back to our continuing discussion on the Roving Caregiver Program. This program has been implemented by the Caribbean Child Support Initiative and now operates in Dominica, Grenada, St. Lucia, St. Vincent and the Grenadines, as well as Belize and Jamaica. It's a very important program that has demonstrated without any doubt a clear impact on child development, parenting skills, youth employment, crime and delinquency, and also shows a benefit for early childhood and ongoing educational results. It's therefore very important for us to discuss sustainability of such a really, really important program. We'd like to introduce to you now Anne Shirley, who has joined us and is a financial analyst who has worked across the Caribbean. And we continue to welcome Dr. Didacus Jules as Registrar and CEO of the Caribbean Examinations Council, and Mr. Milton Lawrence, who is the CEO for ECIC Holdings, a company that is owned by 10 indigenous banks in the region. If we were really talking about something that has such a profound impact, long-term influence on social and economic regional results, how is this going to be sustained? Is it a matter, Mr. Lawrence, for governments only, or are we going to have to look at public, private sector, and maybe even civil society partnerships?
Well, I think you're right. Partnerships are key in this area. As Dr. Jules pointed out in the last segment, this is not new, this is not rocket science. There's a lot of this going on. There are a number of initiatives that probably sometimes contradict each other, overlap each other, and I think it's obvious to all who look that in fact there's a fair amount of duplication and to some extent wastage of resources. I think that this issue of intervening with the 0 to 3-year-old kids, especially the vulnerable ones, is so important that we now have to look more carefully at how we provide resources. And I think the partnerships between government and the private sector and civil society are key. In several of the islands that you've mentioned, there are in fact efforts of partnership taking place. Yes. And I think what we need to do is to refocus our efforts and to ensure that the resources that are available are utilized in a much more efficient manner.
Yes.
And in fact, the CCSI experience has been a full documentation of what is possible.
Yes.
Because you have had in 2008, for example, in the 5 territories you mentioned, there were 2,280 children benefiting from the program, guided by 151 rovers.
Yes.
But what is interesting from the snapshot of the results, this group of rovers have had about 2,200 meetings with parents. They've had 137 community meetings. And really encouragingly, the financial indicators of the project. In Jamaica, it costs about, rounding out the figures, about $60 US per year for the roving caregivers to deliver to each child. Can
you say that again? That sounds very low.
60 US, it is very low. 60 US as compared to 900 US for daycare provision for the same child per year.
So the cost benefit is clear?
It is very clear. In St. Lucia, it costs about 600 US per child in the roving caregivers. Notice the costs vary across territory for a number of reasons, but in Jamaica, because there's a much better integration of the program with other modes of delivery, it makes it possible to have it cheaper. So 600 US in St. Lucia. The daycare provision costs 1,000 US, and private preschool costs 1,600 US. So I think, you know, it's very evident that the CCSI has developed a model that can very cost effectively, and importantly for governments in these difficult times, deliver services that are vital at significant cost benefit.
What intrigues me is that I've never heard of a program that will impact children, I mean, almost from the womb to 3 years of age. Youth, because a lot of the roving caregivers are youth who find employment. Parents, communities, because the caregivers are interacting at a community level. So it is really a wide cross-section, deep, and therefore if the benefit in terms of cost is as you say, then how can governments really turn away from such a program? We have seen in most of the islands that in fact governments are now partnering to deliver the program. Is this something that we need to now expand, and how do we include other participatory organizations?
But I think this is sort of the issue now that everybody's looking at, is the way forward.
Yes.
And the couple of things for the private sector and the governments, I think what has just been said, that you're getting value for money. You know, the bang for buck, if you want to think about it in that way. And so the possibilities are there now, looking at who will be the persons who will help to deliver this and to ensure that it is sustained. So is this a role for government? You know, does the private sector assist? Is this something that should sit in the private sector alone? And I think what you're hearing are the possibilities of things like an executive agency being established in some countries within the government system, but with strong participation from the private sector. And I think also looking at the possibility of the role, who takes responsibility, the sustainability that was talked about earlier.
Yes.
Who takes responsibility for this?
My concern, though, you already have an impact assessment, because
Yes.
you have had a couple of years of application in a number of islands. Would you be recommending to governments regionally a process in terms of implementation and a strategy in terms of the framework for administration? Or are you going to allow each territory to decide how to put it in place? Because I think there's a little danger there.
Yeah, I think there are a number of things that we have to do.
Yes.
I think we have to first agree that this initiative is so crucial and has to be seen as becoming a permanent part of our interventions in education.
Right. Yes.
That's the first thing.
Yes.
And secondly, we need to now look at how we resource this initiative and what are the best modalities for getting the private sector and the governments to participate. The NGOs have been involved in this game for a fair amount of time, and they have experience, and I think the willingness is there.
Yes, yes. I don't think we have seen before a program that has such a wide range of positive impacts, impacting children, impacting youth, impacting parents, impacting communities, producing better results in terms of the quality of persons who will enter into our workforce, and also the quality of persons that we will have in terms of administration for national development. And so it seems that we must find a way to have sustainability for the Roving Caregivers program. We're going to be talking in our next segment about the funding that will be required to have this happen, and what are some of the models that we are looking at in order to fund this. We'll be right back.